Hello, I'm Laura Kavanaugh, the Director of the Division of MCH Workforce Development at the Federal Maternal and Child Health Bureau, or MCHB. It's such a pleasure to be with you today and welcome you back to your MCHB-supported training program. We're honored to have you as a trainee. As part of this welcome, I'll cover a few areas today. I'll provide an overview of our priorities at MCHB and our new Division of MCH Workforce Development. I'll share background on MCHB investments in academic institutions nationwide, which includes your training program. And I will describe what's unique about programs funded by the Division of MCH Workforce Development. And finally, underscore the Division's commitment to engaging trainees, you, in achieving its goal of training the next generation of leaders in maternal and child health. As trainees in MCHB-supported programs, you've now reached a point where hopefully you're feeling more comfortable with all of the new information, perhaps a new city, and new demands on your time. We thought the mid-year mark was an appropriate time to share an overview of MCHB, our workforce investments, and why it's so important to engage you as trainees as you begin your journey as an MCH professional. Let's start with an overview of our priorities at MCHB and our new Division of MCH Workforce Development. The Maternal and Child Health Bureau sits within the Health Resources and Services Administration, within the Department of Health and Human Services. MCHB is led by the Associate Administrator, Dr. Michael Liu. He's articulated a new vision statement for MCHB. Quote, "We are going to improve maternal and child health by improving access, quality, integration, accountability, and equity," end quote. As implementation of the Affordable Care Act advances, MCHB's programs will work to achieve this vision through an expanded focus in these 5 areas. Within MCHB, the Division of Maternal and Child Health Workforce Development provides leadership and direction in educating and training our nation's current and future leaders in maternal and child health. We support graduate interdisciplinary leadership training programs focused on the MCH population and workforce development programs such as MCH certificate programs, resources such as the MCH Navigator, and we're expanding investments for practicing MCH professionals through new MCH workforce development centers. In fiscal year 2012, the division investments included $47 million to 173 programs across the country. Funding is directed to support faculty, trainees, and overall program infrastructure. The reach of the programs is quite dramatic. In 2010, the program included 25,000 trainees, about 2,200 were long-term trainees, 45,000 medium-term, and 17,000 were short-term trainees. 24% of all of the trainees that we supported were from underrepresented groups, and 83% of former trainees were leaders 5 years after completing the program. Over 245,000 MCH professionals also receive continuing education through our programs. You can learn more about our specific investments through our website on the screen. You may be wondering what's unique about the MCH training program. While a number of bureaus and offices within the Health Resources and Services Administration invest in training our national healthcare and public health workforces, the MCH training program in the Maternal and Child Health Bureau is the only program dedicated to advancing exemplary practice and leadership in the field of maternal and child health, with an emphasis on core principles of diversity, health equity, cultural competence, and family involvement. Your acceptance into this program ushers you into a legacy of leadership in maternal and child health. Many of our most influential leaders in maternal and child health, from your faculty members to advocates for maternal and child health to those in health departments or even federal service, are former trainees from programs supported by the Maternal and Child Health Training Program. Despite having been accepted into a particular degree program or a track in a particular part of the country, you're part of something larger, the next generation of health professionals who'll shape the health and care of our nation's women, children, and families. Today, I also want to highlight the division's commitment to trainee engagement. I hope that over time, if you don't already, you come to think of yourselves as MCH professionals, along with your affiliation with your discipline, for example. 2 experiences dramatically shaped my commitment to supporting activities that foster trainee engagement. They shape my commitment to building and sustaining connections between trainees supported by MCHB through its many training programs across the country. Many years ago, when I was at Georgetown University, before coming to the federal government, I was part of a team that conducted an evaluation of the MCH training program. We conducted site visits to over 50 programs across the country. And when we interviewed trainees at each site, it struck me how many had no idea that they were part of a national network of trainees, that others were going through the same joys and frustrations, feeling utterly overwhelmed at the beginning of a traineeship or fellowship experience. What have I gotten myself into? Over time, finding their way and becoming more expert, and then near the end of the traineeship, maybe feeling alone again. How can I find a job that reinforces what I've just learned, which I now realize may be different from other settings? That experience stuck with me, and when I became the training branch chief at MCHB in 2001, I wanted to figure out better ways of connecting trainees for support, to learn from one another, develop collaborative research and innovative clinical practice models, and to sustain these connections over a career. The second experience was several years ago when I attended a memorial service for a dear colleague, Dr. Greg Alexander, who used to be at the University of Alabama at Birmingham and then the University of South Florida. At the service, several friends and colleagues reflected on the fact that many of us had grown up together professionally through various meetings and experiences in maternal and child health. In those days, travel funds were generally available, and we were able to regularly travel to MCH meetings where we connected with one another over time. We developed joint projects together and sometimes conducted joint research or co-authored papers. Those connections were sustained over the course of our careers. Our mentors often attended the meetings with us, and they introduced us to the leaders in the field, and we in turn did the same as we grew older. At this memorial service, we mourned not only the loss of Greg, but also that young students and junior colleagues didn't have the same opportunities to make these connections. Often, it was our MCH professional connections across the country that might be stronger than some of our local connections in our universities or local or state agencies. We left the service committed to coming up with creative ways to foster the development of these lifelong connections with younger MCH professionals. Several efforts followed, funded by MCHB, and may offer some ways for you to sustain some of the connections that you're developing as part of your training program. The Making Lifelong Connections meeting is scheduled for this April in Chicago, and the University of Illinois at Chicago-sponsored Leadership Retreat each summer focuses on intergenerational connections between MCH professionals. The MCH section of the American Public Health Association has a very strong student commitment. AUCD has a virtual trainee, and through support from MCHB, hosts trainee webinars and a trainee listserv. MCHB also has been working to develop a stronger trainee voice on our website and by including trainees more deliberately in strategic planning and other initiatives such as the Diversity Peer Learning Collaborative. We would love to hear your ideas about how we can strengthen these efforts. I encourage you to take advantage of opportunities to engage with your peers, whether through the trainee listserv or at national conferences or through participating in working groups that facilitate collaboration. At MCHB, we're committed to facilitating connections now and sustaining those connections into the future. We recognize the inherent expertise in your experiences as a trainee and view you as an invaluable resource to sharing the national MCH training effort. Over the course of your training and beyond, you'll have numerous opportunities to engage with the division on its strategic plans and products, but we also want to learn about your experiences, ideas, and feedback. Over the course of 2013, we'll implement a webinar series for trainees specific to issues that cut across training programs and facilitate collaboration and catalyze your leadership development. We plan to reach out to you and hope you'll reach out to us about more opportunities for engagement. In closing, as my colleague Donna Peterson has said, when you move on from this academic program, you'll naturally find yourself in leadership positions because of the training you've received. You'll be able to collaborate across disciplines, to focus on systems, and to implement change. As a trainee in an MCH training program, you will be a leader, an innovator, and a collaborator. It's in the fibers of your training. Your faculty members in this division are committed to helping you achieve your goals. We're excited to work with and learn from you. Together, we'll improve the health of the nation's women, children, and families. Thank you.